Hey guys, once again, thanks for being here. Tonight I'm going to be talking about something a little bit different. I'm talking about some most common ridiculous male nurse stereotypes. Some of them are common, some of them are ridiculous. You can kind of choose which ones you think are which. But for those of you guys who don't know who I am, my name is Jason Rozinka, and I've been a nurse here for the past 20 plus years. And obviously, I'm a dude, so I've been around for a while, and I know what the stereotypes are, and I've seen them, and I've seen some discrimination too, and kind of lived it. And I'll show you that kind of at the end of the video here. But I noticed a lot of this more at the beginning of my career. Things have kind of evolved for male nurses. Just in general, there seems to be more. The population is going up. We're still severely outnumbered. There's about 9% of all nurses are men. And with that, there's some common stereotypes that come with men going into nursing. So I'm going to go through a few of them here. One common question that I get a lot from patients, I still do. When you walk in a room, they ask you if you're my doctor. They just assume that since you're a guy walking in with some hospital scrubs on, that you're their doctor. Although sometimes on night shift with some confused patients, I have maybe acted as a doctor just by talking to them, not by writing orders and stuff like that. But sometimes it helps calm patients to have that male figure or that doctor figure. And if that's what they're screaming for in the middle of the night, that's what we kind of did, and it worked. But I don't recommend doing that, but sometimes it just kind of worked out, and that's what we did. So even if you ask them, say that I'm not your doctor, I'm your nurse, they ask you right away, when you're going back to school. You get that a lot too. Another one is that you chose nursing as a man because it was easy. I assure you that nursing school was not easy. I know that I spent some long nights studying when a lot of my college roommates were out partying and having fun. And it's not an easy profession to get into. The schooling is very tough. It's very rigorous with clinicals and everything else we do in studying. So that's not true. They ask you if you're gay. And I'm not going to get into that at all, besides the fact that that is a ridiculous claim that all male nurses are gay. It's just not true. I'm not going to say anything more about it. Or how about, did you fail med school? Is that why you're a nurse? They assume that if you fail med school, you can just all of a sudden become a nurse. You don't have to do any more schooling. Or it's just an easy way. If you fail med school, you've already got some of your training, you can just become a nurse, and that's why you're a male nurse in nursing. Another one that's ridiculous. How about that you chose the profession to be around more women or chase women around? I think that's another ridiculous claim, another ridiculous stereotype. Heard it many times. If you chose a profession just for that, that's just not. It's not even worth talking about, because that's not what people do, and that's not why men went into nursing. That's not why I go into nursing or anybody else that I know. Discrimination-wise, I think that you can deal with discrimination how you want to deal with it. I take it with a grain of salt. If it's really offensive, you call people out on it. But you've got some patients that just refuse to have a male nurse, and you have to look at why they're doing that. Some of it is generational. If you've got some older patients that, the only patient that I've really had refuse my care was a 95-year-old lady who just did not want to have a male nurse. And that's fine. That's legit. Or if you've got some people with some sexual abuse issues, or there's multiple issues that you can get into why people don't want male nurses. But it happens. It's not always possible to offer that with staffing issues, but you try to accommodate as much as you can. How about men? Another discrimination is men helping with every single lift on the floor. It seems like some nights you can go from room to room to room saying, I need some muscle in here, and they grab the first dude they see out there, first nurse they see out there to help lift. And I love helping out, and I'll help out as much as I can, but we need to be safe out there as guys, and we can't be lifting every single patient. They're getting bigger, and our backs can get hurt just like anybody else's can. So another one is sometimes you're not respected by the docs, and it's this is a tougher one to deal with that sometimes, but it happens. It's discriminatory, and they just sometimes just don't seem to respect you as not going into med school, which is still one of those more ridiculous claims, but it happens. And I notice it more if you see some doctors outside of the hospital. They don't seem to be as friendly to you outside the hospital. And it is what it is. That's, it's just like any other person. I don't care who they are. You don't want to be around people like that anyway. So take it with a grain of salt. All right, guys, these are just a few. I could go on and on about these, but these are just a few of the stereotypes that male nurses have. And they're there. I think they're going away as we kind of evolve and more men are going into nursing, and hopefully it doesn't discourage you to go into nursing. It's a great profession, and hopefully you'll be a nurse and you'll love it, and you'll continue down your path. All right, guys. Hopefully this was interesting to you. If you liked it, like, comment, share, and I'll see you tomorrow where I'm going to talk about what you can do when you're discriminated against or these stereotypes are brought up in front of you. Different things that you can do to kind of get you through that and not get discouraged. All right, guys? Have a great night. Peace.